All right, welcome back to OrthoLinks Podcast. We're back with Dr. Renelus today, and we're going to talk about some sports medicine. Today, we're going to talk about concussions. So, say hi to everyone and give us an update on how things are going over the first couple days and what your plans are next week.
Hi, everybody. I am happy to be here again and talk about concussion. It's been a great couple weeks, great couple days. We're growing, we're expanding, we're getting things set in place so that in the coming weeks we can really hit the ground running in St. Pete and at Rocky Point.
Awesome. Well, concussions are very common in sports, and at least the knowledge that concussions exist have evolved over time. So it's a really important topic that we're going to talk about today. So first of all, just tell us what a concussion is.
So a concussion is a mild brain injury, which sounds really scary. But the good news and what I always tell patients is they're going to get better. Most people get better. But yeah, it's a mild traumatic brain injury, and it is caused by either a direct or indirect force that causes either a shearing or rotational injury to the brain. That's a question I get a lot, is people wonder sometimes if they can truly have a concussion if they didn't get hit in the head. And the answer is yes. You don't have to have a huge blow to the head to have a concussion or get a concussion. It can be a force somewhere to the body, but if it causes a severe enough, almost like a whiplash injury to the head or a rotational injury to the head where the brain gets injured, you can have a concussion from that. And so the other thing we always tell people is that there's a lot of different symptoms associated with concussions. And so it's really important to get checked out by somebody who understands concussions and how to take care of them.
So if I'm hearing you right, you're saying if there's just a suspicion of a concussion, they should be evaluated as soon as possible.
Absolutely.
What about wearing a helmet? Do you think that prevents concussions?
So that's, again, something that I think a lot of especially young athletes believe, is that once they have their helmet on, they're invincible and can't get a concussion. Wearing a helmet does not prevent concussions. At least the studies don't show that it clearly does. Things like headgear, like helmets and mouth guards, they are really great for preventing injuries like skull fractures or dental injuries like, breaking or chipping teeth. But there's no clear evidence that they prevent concussions.
Okay. So let's say that I'm a parent of a high school football player, and the athletic trainer says they need to be evaluated for a concussion. Should I take them right to the emergency room? Do they need a CT scan or an MRI scan of their brain? Like, what's the next best step?
So you don't have to take them immediately to the emergency room. Certainly for severe injuries or symptoms that are getting significantly worse, you may want to consider a trip to the ER or some imaging, but most concussions can be managed without imaging. You don't have to have a CT or MRI. A lot of times the athletic trainer will get in touch with either the team doctor, or you can, if you have a doctor that you feel comfortable seeing that can manage that, you can see your doctor as well. But a lot of times the athletic trainer will get in contact with the team doctor and let them know what's going on. And yeah, you don't necessarily have to go straight to the ER and get a CT. Like we were saying before, concussions are more a functional injury than a structural injury. And what that means is you're not necessarily going to see the changes on CT or MRI. But what's going to clue us in that things aren't right are going to be your functional symptoms. The headache, the trouble concentrating, the problems with balance, and some people mood changes. So your symptoms and the exam of the athletic trainer and the doctor are really going to drive the management of the concussion more so than any CT or MRI.
Okay. So let's say there's an athlete, let's call it a lacrosse player, who gets hit in the head and has a suspected concussion. Can you walk patients and parents through what to expect once they see you for an evaluation of concussion, and when can they get back to play?
So starting from the beginning, when they first kind of get hit in the head or sustain the injury that causes the concussion, the athletic trainer is going to evaluate them right there on the sidelines. And they're going to be pulled out of the game. If there's any suspicion that they have a concussion, they're going to be pulled out. They're not going to be allowed to continue to play because we don't want to add insult to injury. And then once they see me in the office, I usually do like to see them pretty soon within the first few days. That way I get a sense of where they are early on in the injury. And then when they follow up with me later, I can kind of see the progression of if they're getting better and how their symptoms are being managed. And then that may help me guide treatment in terms of, do they need accommodations for school? Because again, a lot of kids or adults will have, difficulty concentrating or remembering. In addition to headaches, it might make it hard to do a lot of schoolwork. So what we can do is we can write notes and inform the school so that, if they need extra time for test or, maybe a more quiet environment to do their testing, we can facilitate that with the schools. But usually what will happen is after they are evaluated by the athletic trainer, held out of the game, they'll get an appointment with me like pretty soon thereafter. We'll see them, we'll do some additional assessments, and then we'll kind of come up with a plan of, okay, this is what the next few days looks like. Maybe let's cut back on schoolwork for a little bit to give the brain a little bit of time to recover, or we might have them do their schoolwork and activities, but just at a lower level, a level that doesn't elicit symptoms. And usually I'll see them in clinic every 1 to 2 weeks. Again, it's patient by patient, depending on how severe the symptoms are. If they have a lot of severe symptoms, then I'll see them more often.
Sure.
If it's a patient that we feel like we can space out the visits a little bit more, we will. But I'll see them every week or two in clinic and get a sense of how they're progressing. And then once they are fully able to return to play, or we think that they are, and their symptoms are resolved, then again, we are always touching base with the athletic trainer
Sure.
and the coaches and people that are going to see that kid in their play setting. And we come up with a plan for return to play. And that's a gradual return to play.
Sure.
It's not like, oh, once I'm better, I go back in the game. But we want to make sure that, each day we're slowly increasing the activity. And as long as there's no symptoms, then we'll progress to the next stage. And then that final stage being a return to gameplay.
Sure. And I think there's a protocol, right? So Florida has a protocol that you have to pass through that to return to play. So if I hear what you're saying is there's actually a great chance that if you have a concussion on Friday night that you may not play the next Friday. Is that true?
That is true. And that dashes a lot of hopes and dreams. But again, it's right. We want to take the best care of the athlete that we can in the short term to allow them to have a long-term career. So yeah, if they have a concussion on Friday, they're not necessarily playing next week, and they shouldn't have expectation of playing the next week, because even if all their symptoms disappear in a few days, it takes, again, time to work through that gradual return to play protocol.
Sure.
And that's in Florida, as well as a lot of states have similar rules and laws and protocols to follow. And again, that's in the interest of safety of the player.
Sure. If I have a concussion, should I just go and turn the lights out and be in the dark and just have no interaction? That's a common belief that you go and turn the lights out and rest and have no motion. What would you say about that?
That is a common belief, but it is incorrect. That's definitely old school thinking, something that, again, people used to do back in the day, where it was just like you put them in a dark room, you don't let them do anything for days. And again, what we're learning with the research is as soon as we can get athletes back into their usual activities, the better. Again, the goal is to keep their activity levels at a level that's below the threshold that causes symptoms. So again, if they, start doing more activities, or maybe they try and go for a jog and man, that really exacerbates their headaches or causes them some dizziness, then we know that that is not the level of activity that they're ready for. And maybe they just need to do some brisk walking or some stationary biking or something like that. Again, with concussions, there's a myriad of symptoms, and some of those symptoms are mood related. And if you already are not feeling good and you're somebody who's used to being active and playing your sport, and all of a sudden you're shut in a dark room and doing nothing for weeks, that's not going to help your mood. So that can actually compound and make it harder to get better, or harder to judge how much the patient is improving when you limit them so much. So a little bit of, again, supervised activity that's sub-threshold we actually know can be very helpful for physical and emotional and mental symptoms of
Sure.
concussion.
I think what I'm hearing you say is that concussions can be very different depending on each athlete. So you're not going to have recovery period that's the same for anyone. Is that true?
Very true. Absolutely. I've had patients who are better in a few weeks. I've had patients who take months. It's a very individualized approach. And so, again, that's also the benefit of seeing the patient multiple times, because then I can gauge, again, if they're getting better, how much they're getting better, or if they're declining and there's something more we need to do or look at in terms of management or further evaluation, whether it be imaging or anything like that. But everybody is very different. It's a very individualized approach. Some students need a lot of accommodations, some don't need any. So it really is patient by patient.
Sure. And there's not really an external injury that anyone can see, right? So when their teammates and everyone is ragging them for why they're not playing and they're walking around and looking normal, that can be a difficult situation for the athlete. So what would you say to an athlete who is getting ridden by his teammates and maybe he's the star running back and they really need him to win, but he really is pushing the envelope to try to return to play even though it's too early? What kind of advice would you give to the athlete and the parents?
Yeah, absolutely. So that's where education, I feel like, is paramount, because if the athlete and the parents know what the goal is and why we're placing the restrictions that we're placing, it becomes easier for them to cope with it, and also maybe easier for them to explain to their teammates
Sure.
about what's going on and why they can't necessarily play. And then again, all good athletes want to be of benefit to their team. So then the other thing to explain to them is, look, if you're not 100%, you're not going to help your team much.
Sure. Sure. Okay. Is there a magic number of how many concussions someone can have before you say, I'm going to retire from football or I'm going to quit playing? I've never seen a table tennis injury with a concussion, but let's say table tennis as well.
Um, there is no magic number. And this is a hard conversation to have with student athletes and with parents. Um, a lot of times they want to know, if it's a certain number that'll keep them from playing, and there isn't. And again, this is where it's very individualized. Things that maybe would make me worry more are if all of a sudden there's an athlete getting more frequent concussions with less severe trauma. If the injury is less and you're getting concussive symptoms easier, that's a big concern and something to consider in making those decisions. Um, and again, depending on each student and maybe their history of previous concussions, and if they've had a lot of concussions in the past, or if there are any other additional maybe medical problems or comorbidities that confound the picture, all those things are things you need to take into consideration. But no, there's no magic number. For some people it's more, for some people it's less, and some people make that decision on their own without me
Sure.
intervening,
Sure.
depending on their experience with the concussion that they have.
Yeah, I think even though we have some work to do, I think the light that's been drawn towards concussion and awareness of that has been as good as it's ever been. Even it's essentially changed the way that we play football on a collegiate level and in a professional level with personal fouls and ejecting people for leading with your head and those type of things. So the awareness is better than it once was. But
Absolutely.
the traumatic brain injuries that come from multiple concussions have sometimes dire repercussions to an adult or even a child. And we probably don't know how to measure those or look at those in a way that can predict who's going to have those issues going forward. So it's definitely important that we're aware and that we're protecting a 17-year-old brain for their 77-year-old life. And that's one thing that
Absolutely.
when you're 17 years old, it's really difficult to care about your 77-year-old self. But that's one of the reasons that you're here, right? To be intervening and giving an education, like you said, and to give advice to parents. And parents can sense it way better than the athlete can sense it about their
Yeah.
77-year-old future child. But anything else that you would like to say about concussions? And if not, then tell us how to get in contact with you. And we will send this information out to everyone, athletic trainers and athletes who are looking for someone that's a reliable source for concussions that you can take care of them going forward.
Absolutely. So the easiest way to get a hold of me is to call or message OrthoLinks, and you can find that information on the OrthoLinks website. The phone number's there, as well as there's a little box on the bottom right corner of the website that allows you to message us. So you can put a message in there, let us know what the concern is or what you need to be seen for, and we'll make sure you get scheduled.
Is there any chance that you could see patients on the same day or the next day now?
Yeah, there's absolutely a great chance of that for
All right,
sure.
awesome. All right, well, thank you so much for the talk, and we will look forward to the next podcast.
Thank you. We'll
All
talk to
right.
you soon.